Hello, Noobs. So, we have started a new podcast for auditory listeners and it will be available on every major platforms. Please kindly hit the follow button and subscribe our YouTube channel for the daily updates.
In this video, we are going to watch about COVID related queries. So many people have many doubt about COVID and it's about test, diagnosis, treatment, so many things about COVID. Let me discuss one by one. We are categorizing this video into three topics. First is about COVID diagnosis and second one is treatment and third one is about vaccination techniques. Which is the best test for detecting COVID, whether antigen or RT-PCR? Don't skip this video, it will be helpful for you because I am explaining about the trap behind this COVID. For antigen test, it is simple and rapid. For this, it required about just 30 minutes to get the result. It is easy to diagnose whether you are COVID positive or negative through antigen or RT-PCR. For mostly 25 to 30% of people will show COVID symptoms even after their antigen or RT-PCR result is negative. Mostly your physician refer you to go for another RT-PCR test for confirmation. But even after the RT-PCR is negative, at the same time the patient will show sometimes COVID symptoms. At that case, a CT scan is important to detect whether the patient has COVID pneumonia or not. In that manner, we can diagnose whether a patient is positive or negative through this retest. Next part is medication. What's the main medication that mainly given for COVID treatment? Most of the people will go for antibiotics, but the answer is not because it's a viral disease. For viral disease, antibiotics is not well for. Antibiotics have no role in COVID-19 because for viral disease it requires antiviral medications. For mostly, your physician will give treatment according to your symptoms and medications also. For the people who are in high risk category, they require more treatment. Let me tell you who are all under risk category. First is diabetic persons. Diabetic persons are always in a high risk category. And next is hypertensive patients. And it also includes cardiac disease patients, cancer patients, and the last one is kidney patient. If you are a kidney patient, it will also under high risk category. Mainly antiviral drugs are ivermectin. This is the treatment regimen of COVID-19. What happens when your antigen test is negative? You think you are free from COVID-19? Approximately the answer is no. Thus, it indicates that you can't transfer your COVID to another person, but you can get infection in future. Next, I am going to discuss about phases of COVID-19. It consists of mainly three phases. First is viral phase, and second one is pulmonary phase, and the third one is hyperinflammatory phase. Let me discuss one by one. What's the first phase? It's called viral phase. In viral phase, people show symptoms like fever, throat pain, cold, cough, and sometimes loss of smell, malaise, diarrhea, all these symptoms. All these symptoms are seen in first phase of COVID-19, that is viral phase. At viral phase, about 80% of people are shown or wind up within 5 to 7 days. Even after 7 days, so most people will get cured from COVID-19. In these cases, some persons may get into second phase because some people think that they are cured from COVID-19, but the answer is no, because Some people have intermittent fever in that manner. About 20% of people will meet second stage of COVID-19. That's pulmonary phase. The pulmonary phase indicates the patient shows symptoms like fever that's intermittent and breathing problems, and sometimes the patient will also show some allergic problems also. How to diagnose whether the patient entered into second stage of COVID-19? It can get diagnosed through mainly blood test, X-ray, and sometimes D-dimer test, and mainly CRP test. In this manner, a person can diagnose whether they affected from second phase of COVID-19 or not. A CRP test is a simple test that anyone can go for detect whether they enter second phase of COVID-19 or not. In this manner, we can diagnose whether a person entered into second stage of COVID-19 from first stage. What's the treatment regimen for people that already gone into second stage of COVID-19? You may think of antibiotics, but it's not. Mainly it requires corticosteroid treatment and anticoagulants, and mainly the patient needs to check for oxygen saturation. All these are important in second stage of COVID-19. In this manner, you can treat a person to cure from their COVID. After that, we can diagnose whether patient is COVID positive or negative through proper antigen or RT-PCR test. If you diagnose early the second stage of COVID-19, you can prevent the person from entering into third stage of COVID-19. Because third stage is the hypersensitivity stage. In this stage, the patient will need a ventilatory support and mainly oxygen therapy. All these are important in third stage of COVID-19. When you enter into second or third stage of COVID-19, you will require an hospital treatment for better cure. The next thing is about vaccination. What's the status of taking vaccination even after you get cured from COVID-19? Mainly, you need to complete 90 days or 3 months in order to take vaccination. Next common question is, even if a person gets first dose of vaccine, but at the same time they got positive for COVID-19, when should they need to take second dose of vaccine? The answer is, they need to wait for 3 months or 90 days for to complete their second dose. Next common query is, when should a person able to donate their blood after vaccination? The answer is, they need to be wait for 14 days. Another question is, what about breastfeeding mothers? Should they able to take vaccine? Yes, they can take vaccine. And the last question is that, what's the status of a person if they get dog bite? Should they get vaccine immediately? That's mainly anti-rabies vaccine. Yes, they can go for anti-rabies vaccination because this vaccination is important to prevent another complications. So they can go for anti-rabies vaccination without any problem, even if you are taken first dose or second dose of COVID-19 vaccination. So that's all about today. Next day I will reach you with another topic. Stay home, stay safe.